Well, the issues are many, but we have very articulate minds to intervene on the matter. Dr. Osaho Inabulele is past president, Nigerian Medical Association, chief consultant, family physician, president of the Commonwealth Medical Association, and a member of the executive committee of the World Medical Association. You're welcome to the program, sir.
Thank you very much, Mark.
We also have with us Dr. Ike Odo, who is the president, Association of General and Private Medical Practitioners of Nigeria. You're welcome to the program, sir.
Thank you, Mokwe. Good morning, Nigerians.
Well, let's quickly take your intervention, because this strike of the National Association of Resident Doctors has gone on for about 2 weeks now. What's your reading of the steps at mediation and reaching a resolution? Are you satisfied? Do you think one party is guilty over another? Let's quickly have your take, sir.
Well, thank you very much. I think a lot more needs to be done to make sure that these issues are quickly resolved, and a lot more from the government side. To make sure that the perennial issues, what has become almost like perennial issues, are quickly resolved. So they must, continually engage rather than issue threats and some declarative statements that do not inure, to the progress of the medical sector. So they must get back to the negotiation table and engage the issues in a way that will bring progress in the health sector rather than being adversarial, in their own engagement with the resident doctors. The issues, the demands are very legitimate. They are germane. They've been on the table. And of course, there are even laws that even obligate even the government functionaries to implement certain provisions, for instance, the Medical Residency Training Act of 2017. So nobody should, be bellicose about this. We must engage the issues from a patriotic standpoint. So I want to advise that rather than institute some measures, which they claim are punitive, for instance, a no work, no pay policy, which I consider as very bourgeois, a very bourgeois prescription, because there is no pay, no work, and yet you have no work, no pay. So such bourgeois prescriptions should be downplayed and in a very patriotic manner, engage the issues and resolve it as much as you can.
Okay, I'm just wondering why you think that the NMA has not been as declarative as it ought to be concerning the strike.
Well, I'm not the president of the Nigerian Medical Association. I'm sure he's the spokesman for the NMA, and I'm sure they will speak at the appropriate time. But I'm aware that the NMA has been involved in some of the meetings that were called by, the National Assembly, particularly the Committee on Health Services, led by Honorable Tanko Sununu, who has done, who has exercised his roles in a very commendable fashion. So I'm sure the NMA president at the appropriate time will make a very profound statement.
Let me quickly have your take, sir, on the issue of the strike. You head the Private Medical Practitioners Association, Association of General and Private Medical Practitioners. There are those who believe that, that sector is going to be the beneficiary of this particular strike action. Is that the case?
That cannot be the case. We can't be seen to be beneficiaries when our colleagues are endangered. The frustration of our colleagues should not be our own benefit. We are one, public or private. The question of the NAT strike is a major concern to everybody. And for a country, a developing nation like Nigeria, we need to do a lot more than we are doing. We must wake ourselves up from the self-imposed slumber of social decadence. We can afford to do more than we are doing for our country, for our doctors in particular. The average NAD member, the average doctor in this country, these are the reasons, these are the factors. How can doctors be in pain? How can they be like warriors in the trenches with their own government, their own people, a people they have vowed and unpledged to serve, to labor for, to put their lives on the line? How can we be from one problem, one complication, one battle to another, like my dear colleague said, my president said, perennial, a recurrent decimal? It questions our consistency, it questions our commitment, it questions our will to collectively address our own problems and provide solutions. We don't have to refer to anybody. We are a nation. We should look inwards and prescribe for ourselves what we think is best suited for us. That is what I think. The NAD problem should be addressed. The table is the best battlefront. Let's talk. Let's agree. But after agreement, implement the terms of the understanding.
Well, while we're waiting for that to happen, there have been huge questions on every part. First and foremost, what impact this is going to have on our medical sector. There's definitely concern on the current state of our medical sector, and it is reflected in almost every area. I mean, if you look at the current challenges that we're facing, cholera has claimed the lives of over 800 people so far, even though we've been told that, yes, it's not particularly a medical, it's not only a medical challenge, and primarily the fact that people even have cholera raises its own questions. But then cholera is a treatable disease, isn't it? So there'll be questions as to how this many people have lost their lives to something that we could have caught on time and treated. I do not know if you have your thoughts on that.
Well, everything borders on the issue of the commitment of the government to health system reforms and ensuring that the necessary capacities and environments are created to stave off issues like this, which, of course, is very blackmailing to a country like Nigeria, that to date, we still have issues of cholera, confronting our people. And if you like, the ordinary people, who, of course, are living in the fringes and even sometimes in cities. So it boils down to the issue of how committed we are to health system development in our country, the issue of health system resilience and all of that. And a clear example is the fact that even as we are speaking now, to show the level of disconnect by the leadership, in terms of the health system development issues, the president, is away abroad. Procuring healthcare services abroad, along with some other officers of government. So clearly, these are issues that border on simple strategic reforms, including at the level of the communities, for instance. The issue of health education, the issue of health advocacy, the issue of emplacing preventive measures and modalities on ground, and ensuring that they are there on a sustainable basis. Not this off and on thing, today is cholera, tomorrow is polio and all of that. So I think it borders on the issue of reforms, the issue of commitment to health system development, the issue of investment in the primary health care system, for instance, which, of course, should attend to some basic issues within the communities and all of that. The issue of ensuring that there is some level of sustained funding.
We know what to do, because there's been a lot of conversation on
Absolutely.
this. Right. We've also talked about universal basic primary health care or something.
Universal health coverage.
Exactly. Now, what is the gap? Why is it so difficult to will I say, see significant progress in implementation? Because for a number of people, that's where the gap is. It's not like as if we haven't had enough conferences talking about the general decadence in the health sector and what needs to be done. Why is that gap still as wide as it is?
Yeah, like I said, one of the key drivers of health system development in terms of, the agreed parameters is the issue of leadership and governance and the issue of commitment to healthcare development. That is primary. So when you do not have that consistent engagement by the leadership, and in fact, if they do not understand the nexus between health and development, then it becomes a major problem. And that explains a whole lot of the gaps that you see. That yes, the solutions are there, but who is implementing? Who is tracking? Who is monitoring the progress of the health sector? 2014, I was part of those who sat in Aso Villa, and we made a declarative statement on universal health coverage, of how Nigeria should attain, universal health coverage. But after that, it became a piece of paper in the shelves of government functionaries. So nobody is tracking, nobody is monitoring, nobody is sustaining the investment in the health sector. We will wait for COVID and others to know that, healthcare system is in a very, lugubrious state. So the issue of leadership and governance is key. There are other ingredients. The issue of healthcare financing. The issue of ensuring that we have even community engagement. Because again, if the citizens are not involved in your health system development, you're just going to be wasting time. So how involved are citizens? What is the state of the private sector, which is a critical, sector in health system development? Because when we talk about health, we're talking about the private and public. So the overemphasis on public to the neglect of the private is also not helping issues. So there is a concatenation of factors which the leadership needs to engage on a continuous basis. And that is why reform is a sustained dynamic process towards ensuring continuous progress and quality in our health systems.
You know, I have a confession to make. I usually love to read columns. And today, in the back page of Leadership, you have this conversation with Azu, and he's writing about an encounter with a doctor. It's your life. It's a pretty interesting read. And I think that for a number of people, if you read the stories here, it summarizes oftentimes the sort of encounters that we have with doctors. A lot of people have abandoned government hospitals. It's only when people are pressed that they go to government hospitals. You know, those who can afford it oftentimes will go to the private hospitals. But then there are questions of standards. You know, who is looking at what is happening? Who is looking at even the little that we have? How we're ensuring that the best service is provided when and how it is needed. Who is ensuring that, you know, whatever happens in that particular sector, somebody is held responsible for it. As a doctor, you cannot do this. As a doctor, you cannot do that. Or as a medical practitioner, or as a, you know, someone, if you're a nurse or whoever it is you are in the sector, you know, there's certain things that you cannot do. And if that happens, you are held responsible. Is there any conversation around that, especially in the private healthcare sector, Dr. Odo?
Yes. My president has said it. We have one health system. No Nigerian suffers from a private malaria and none suffer from a public malaria. We need to have a holistic approach to emphasizing the development in the healthcare delivery system. As a matter of fact, the private medical sector of Nigeria is the largest provider of healthcare. It is very obvious. 7 out of 10 Nigerians who need medical care out there end up with the private sector. The question then is, why is the same private sector almost completely outside the radar, outside the coverage, outside the purview of government? Government does not seem to know that they are there because we have been there. Yesterday, we marked our 100 years as an association, for example, showing that for 100 years we've been there silently but very consistently supporting the healthcare delivery system of the country and anywhere in the world.
Yes.
What do you want? The private sector.
What precisely do you want government to do? Because some people will say that government hasn't quite paid enough attention to the one it is responsible for. I mean, directly responsible for. Yes. What exactly is the private sector looking for?
The private sector believes that it's been left to its own, to struggle. Whatever your capacity as an individual or group is what you end up with. And yet, anywhere in the world, government is the driver. Government is the patron. Government is the authority. They come in, provide the enabling environment, provide a supportive atmosphere for the sector to thrive. Go to Dubai, go to India. What is the magic? There are no magicians in India. The Indian doctors simply have an understanding with the private sector and government. Government said, what can we do for you? They gave them health banks. The taxes for doctors or for hospitals are not the same. They are obviously subsidized. If you have to make imports for your consumables, for medication, why all the taxes? Why will I have to go to a bank as a hospital provider, a care provider, hospital owner in the private sector, and the same interest rate that oil companies are giving is what you get? And the hospital is not a business. We are social providers. Government needs to come in, support this system, give us that opportunity that we need. Infrastructure, light, power is a big issue. Over 40% of your earnings in the private sector goes into power. It has become part of the basic requirement for your facility to be accredited, for example. You don't come to a hospital to accredit, you must show at least 2 generators. Minimum standard now. How many Nigerians can afford it in this era? Especially with the somersaulting and the tumbling economic indices in the country.
Why is it so difficult for entrepreneurs in that sector to partner. For a number of people, it would seem that, when they do go into private practice, one individual oftentimes tries to go it alone. Why haven't we seen more partnerships in that sector, considering the challenges
we are seeing partnerships, and partnerships are beginning to grow. It's understandable. It's about human nature. It's about the individualization of concepts, the difficulties in the compatibility of men. Some have succeeded, some have failed, and it is the same anywhere in the world. But we can see group practice growing by the day in Nigeria. And as a matter of fact, they are the real people, the real centers that are keeping Nigeria today. The private sector, both at the primary, secondary, and tertiary levels, are the ones giving Nigeria the identity and the hope that we have in the private sector.
The original question was about standards, about what happens when standards are not kept, about the falling standards of medical services being provided when medical services do exist.
No, we have clearly defined standards. The MDCN, the Medical and Dental Council of Nigeria, stands there as the regulator. Standards are kept at the state levels. The Ministry of Health has its monitoring teams, and standards are well defined, and they are kept. And of course, the medical profession is about ethics. We are a people of ethics, a people of protocols, a people of values. And those standards are defined, but what we want to ensure is that they are monitored, they are evaluated, and they are sustained to be sure that none falls below those standards. And it's been done. Just last week, the MDCN had its open trial of doctors who probably have been seen or cited to have fallen below the standard, to show you that monitoring is a key component of what we do, and the MDCN is not sleeping over it. As an association, we sing it like a song. You cannot afford to play with standard because we're not carpenters. A carpenter can lose his table and replace it the next day. Ours is the most demanding of all professions. We deal with life, and none can be replaced.
Let me quickly ask you how brain drain is affecting the manpower that you have in that sector. Is it a big issue for you?
Mokwe, and I want to use this opportunity to tell Nigerians that let nobody deceive us. If there was any time that something should be done about brain drain, this is the time. Let me just share my own experience. In my small facility, last year alone, I lost 5 radiographers to the UK. This year, I have lost 7 doctors to the UK. 2 radiographers have gone, and many have tendered their resignation. As I speak, my gynecologist has his family out already. He has planned to leave. He's on annual leave now, but had planned to be given 2 months' work, leave without pay, to enable him settle. They are leaving. Everybody wants to leave. It's as bad as the average Nigerian doctor or nurse or pharmacist closing his eyes and jumping into the next available plane. He doesn't care where it lands anywhere, as long as it's outside Nigeria. It's as serious as that. In one of my interviews, I made it clear that the next cancer that might exterminate the entire health sector is the brain drain.
Let me quickly come to you, Dr. Nabulele. I do not know, how you think that Nigeria can address this issue, because you heard the Minister of Health there saying how much the Nigerian government also spends in training its doctors. The question is whether we're spending as much to retain them, to make sure that they stay after we have spend so much in trying to get them trained.
Well, thank you very much. But first, let me go back to the issue of service delivery and the issue of quality. The reality is that there are providers who are doing their part, like the private sector and even the doctors and other health professionals in the health sector. But the reality is that Nigerian landscape is riddled with what I call charlatanism, quackery at its highest. And that informs the need to continually engage the issue of quality and standards. Unfortunately, the prescription in National Health Act which obligates the officers of government in the Ministry of Health to prescribe certain standards and even issue a new directive on the certificate of standards, is yet to be implemented. The issue of clinical governance and establishing clinical governance units in the various health institutional sectors is not being done. So, yes, others are doing the part they ought to play, the doctors, other health workers through their regulatory bodies. But the reality is that the Nigerian healthscape, one of the things, really impinging on the development of the Nigerian health landscape is the issue of quackery, charlatanism. Now, to the issue of brain drain, it's not enough to say you are investing in training. Beyond training, how are you investing in the retention mechanisms? Because the issue of health workforce is about production, retention, and of course, motivation. So the issue of production is there. We're not producing enough. So how are we investing in the production capacity, health production capacity, in terms of the institutional frameworks for producing the health personnel? Today, we need in the medical sector over 250,000 doctors to meet with the ideal ratio, 1 doctor to 600 patients of population, prescribed by the World Body. Nigeria today is revolving around 1 doctor to 4,000 population. So that cannot impact on useful health outcomes. That cannot drive useful health outcomes. So how are we producing? How are we, even those that are produced, how are we training and retraining them? How are we retaining them? I mean, look at what is happening now with the whole issue that has prompted the NAD strike action. I mean, people even want to come into the system. The recruitment policy is so defective. People can't even employ because you have to apply for waivers. I mean, such bureaucratic retapism and administrative shenanigans is not helping the development of medical manpower or health manpower in our country. So what motivational mechanisms do we have on ground? As I speak to you now, the environment is so defective, largely. The working conditions are very pitiable. And, of course, buoyed by the issue of insecurity, which affects all Nigerians. Nobody wants to spend time, the rigors, going through a very high-skilled profession like medicine, for instance, only to come tomorrow you are kidnapped and all your little savings have been, of course, released to kidnappers. I mean, once you are freed from the stranglehold of the kidnappers, the next thing you think of is how to survive. And there are people who have alluring, attractive mechanisms coming even to Nigeria to attract those healthcare workers. I mean, so others, the push and pull factors need to be engaged by governments. There are factors that are pushing our doctors, including the working conditions, the poor, uncompetitive wages, the insecurity issues, all right? And, of course, the attractive pull factors from other places. Even in the midst of COVID, you saw the UK government emplacing very attractive policies and programs for healthcare workers all over the world in the face of Brexit. And who will not get attracted to that? So for those of us who are even straining ourselves to remain in our country, I think we should be appreciated. But that is not even being done. Because rather than patronizing Nigerian professionals, health professionals, our government is patronizing those abroad. So it further tells me that I am not even valued in my own country. So perhaps the best place to be valued is to go abroad, where I will have the opportunity to treat my president, to attend to my president, because that also gives you some level of self-esteem and professional esteem. That, you are here treating your president. So if I cannot treat my president in my own country, would I want to go outside to treat my own president? So the issue of recognition of the sense of worth, the sense of value, and the merit of the healthcare professionals in our country also needs to be addressed. So there are a lot of factors in this. But my worry is that it looks like a vicious circle. Because I tell you, I presented a paper on this at the Commonwealth level as far back as 2004, 2005. So the issues are not new. But what is missing is the commitment towards the sincere resolution of these problems. It's a fine place to leave it. I think that you have summarized it very nicely, and I hope that it's able to kickstart even further conversations and, also some introspection on our part. Gentlemen, thank you so much for your contributions this morning on Sunrise Daily. Dr. Osahon Inabulele is the past president, Nigerian Medical Association, chief consultant family physician, president, Commonwealth Medical Association, member executive committee of World Medical Association, and Dr. Ike Odo
is the President, Association of General and Private Medical Practitioners of Nigeria. Once again, gentlemen, thank you for coming on our program this morning.
Thank you, Nigerians.
Thank you,
and
Nigerians.
we pray for the best.
Well, let's quickly see if we can take a few mails from you. Festus Akimboyewa, you talk about containing COVID-19 in Nigeria. You say until we take tests, trace and isolate seriously Nigeria and federal government, states, public and local partners such as businesses, schools, hospitals, prisons, etc. work together, it will be difficult to contain COVID-19 in our dear country. Government must be bold to take enforcement action against the pastors and imams who are pushing conspiracy theories about COVID-19 in Nigeria.
Cholera outbreak. The outbreak of the cholera in those states is a pointer to say the governors are not doing their jobs. When you check these areas where we have the outbreak, you will see that there is no government presence. And it's as a result of we leaving out our closest governments to focus on the central. We've predominantly vented all our anger on the FG. Meanwhile, the issue of clean environment and potable water and some basic amenities are the functions of state governments. Let the governors perform their duty.
Well, Henry, we also see your mail. The title is a very good summary of what it is. We do not have the time, but I'm just going to take the title. You say, cholera, there should be no excuse. And I think that basically summarizes the stance of us all to this particular disease. There should be no excuse indeed. We have to thank you all for watching the program this morning. It's been a pretty interesting one. We hope that you have a great weekend and that you stay safe. Thank you for watching. I'm Maokwe Ogun Yusuf.
And I'm Ayo Makinde. Stay with us on Channels. More to come.